Hi, I'm Dr. Chad Larson, and this is another episode of Keep It Real. We're going to do another hike and learn. So today, I'm going to tell you about some really new research. In fact, there was an article that was written, just posted in the Journal of the American Medical Association, the JAMA, which is a highly respected medical journal. I've learned lots of very cool scientific things from the JAMA, but I was a little disappointed, to be honest, with this article that was published last week. The article was put out by the U.S. Preventative Task Force, and what they do is they look back at prior recommendations and they update it. So this was an update from a 2008 recommendation for using statin medications for cardiovascular disease. A statin medication is a cholesterol lowering medication. You might have heard of a drug called Lipitor. There's kind of a whole class of these statin medications. And what they said is they sort of upheld their recommendation from 2008, which said statin medications are a good first-line therapy for preventing cardiovascular disease, even though there may not be a cardiovascular event in a patient if they have certain, let's say, risk factors like diabetes, high cholesterol, and a couple other conditions, that if they have these conditions, that a statin medication would be the recommendation to help prevent cardiovascular disease. In other words, if they have certain risk conditions for cardiovascular disease, this USPSTF task force would suggest that a statin medication would be a good idea. Here's the reason why I'm a little disappointed by that, is because here's what's not a problem. Statin medications definitely lower cholesterol. That is not controversial whatsoever. What I'm a little concerned about with their recommendation is that there's other research that says that by lowering cholesterol does not exactly reduce the risk factor of cardiovascular disease. So there's a little bit of a problem. They're saying that the statin medication is good for lowering cardiovascular disease, but the medication lowers cholesterol, which that hypothesis has not really been proven out successfully in the literature. There's been conflicting scientific reports on that. So what other research has told us is that statin medications, while they definitely lower cholesterol, there's no controversy about that, by lowering a certain enzyme called HMG-CoA reductase. It's an enzyme that's a precursor to cholesterol. So when you block that enzyme, it's going to block the liver's production of cholesterol. But it also blocks a really important nutrient being produced in the liver called coenzyme Q10. And by all measures, coenzyme Q10 is a very important nutrient for cardiovascular function. Coenzyme Q10 is one of the gatekeepers in your mitochondria for ATP production, adenosine triphosphate, which is kind of the fuel, the energy source of your cell. So all your cells in your body, your trillions of cells in your body, have hundreds of these mitochondria that are engines for producing this ATP. But your heart cells are even more specialized. They have about 5,000 of these mitochondria per cell. And think about it, it makes sense because your heart is beating all the time, never stops. And so it makes sense that your heart cells are going to have more of these mitochondria for this production of this energy called ATP. And so here's what's disappointing is that it's very clear that your heart needs this coenzyme Q10, but it's also very clear that statin medications block production of this really important nutrient, coenzyme Q10. And that's been very clear in the medical literature. Here's what's also very clear is that statin medications also mess with other nutrients that are supportive for the cardiovascular system. And so the disappointing part of it is that there's lots of other things that we can talk about as prevention for cardiovascular disease. But here's the thing, is that pharmaceutical-based medicine, the drug, the pharmaceutical, statin in this case, is like the only tool in the toolbox. So if you have other tools in the toolbox, then you don't have to depend so heavily on the statin medication, because there's so many different things. There's so many other things to use as therapeutic support for preventing cardiovascular disease, like essential fatty acids, like fish oil. There is study after study after study that shows the importance of using fish oils for cardiovascular disease, because what we do know, remember I talked about before that it's not really clear that cholesterol is what even leads to cardiovascular disease, but the treatment is lowering cholesterol to help prevent cardiovascular disease, and that's a little controversial in the medical literature. So what's not controversial is things like fish oils have been shown over and over again to be very anti-inflammatory. And what we know is that the cardiovascular disease that people are suffering from has very much at its root inflammation. So if we can decrease the body's systemic inflammation, then that would be a much more rational treatment prevention for cardiovascular disease. But that wasn't even discussed in this paper, unfortunately. There are other things. Anti-inflammatory diet. You know, diet really needs to be the centerpiece of people who have, you know, maybe one risk factor for cardiovascular disease, like diabetes. Diet really needs to be the centerpiece. And there's some, you know, very important anti-inflammatory foods, like certain fish that are high in these essential fatty acids, like salmon, a whole rainbow variety of fruits and vegetables. We'll give our fruits and vegetables their colors, are flavonoids and antioxidants that are ridiculously supportive to the heart and the cardiovascular system. But again, that wasn't even discussed in this paper. Some other things to think about is that, why is everybody so concerned about their cholesterol numbers? Is that the only thing that has anything to do with heart disease? Well, first of all, like I mentioned before, cholesterol isn't even kind of the main thing for heart disease. That's what the current literature is telling us, that we need to know so much more about a person to inform us about their cardiovascular risk factors. But yet it's still cholesterol that this particular paper on prevention of cardiovascular disease was concerned with. But what more current literature is telling us, that we need to look at inflammatory factors like your CRP or HSCRP, high sensitivity C-reactive protein, very, very important inflammation detector or indicator. So the higher your CRP, the greater the chance that you have systemic inflammation, and this is a really key risk factor for cardiovascular disease. Or looking at your fibrinogen. People who have high fibrinogen levels are at a greater risk of thickening of the blood and increased chance of getting cardiovascular disease. Other factors like ferritin. Ferritin is really key, what we call acute phase reactant, which basically hear that as another indication for inflammation. So if you have high ferritin, if you have high CRP, if you have high fibrinogen, these are much more, I would say, specific and comprehensive indicators for cardiovascular disease. And again, these things weren't even discussed in this paper. And so I think since cardiovascular disease is really the #1 killer in the US, I would say with diabetes clipping at its heels, cardiovascular disease is something that we all need to understand at a deeper level. And what the take home that I really want you to have from this video is that it's not cholesterol. You need to get past cholesterol. Cholesterol is vital for so many functions in the human body. It's an important lipid in your cell membrane, helps with transport of things across your cell membrane. It's really important as a building block for all of your steroid hormones: testosterone, estrogen, progesterone, cortisol, DHEA. They all have as a building block cholesterol. So if you get on a statin medication, it's going to plummet your cholesterol, which is your key building block for all these important steroid hormones. And like I said before, also it's going to lower your coenzyme Q10, which is so vital for the function in every cell in your body, but maybe most importantly, your heart. And so I just wanted to, like I've discussed before, it's really important that I share this information that I have access to on a regular basis. When brand new research comes out, I want to tell you about it. And so keep tuning in. I'm gonna keep it real and let you know the facts, let you know the options, and we'll see you next time.